We've talked about high-def lipo and how that uses your fat and carves out the fat to create an artificial way of accentuating natural lines, like giving you a six-pack out of the superficial fatty layers. Now, what some doctors are doing is injecting fat and transferring the fat to further accentuate that, only they're not injecting it into the subcutaneous space. We're talking about actually adding fat into muscle, and this is a new trend that can be done safely but carries some risk. We know that doing fat transfer into the butt can be risky, especially if you get too deep, and particularly if you try and inject fat into the muscle. The reason for that is there are very large veins that if they get disturbed, that can lead to fat entering the vein, traveling around, getting into the lungs, and clogging up the lungs, possibly causing a life-threatening problem. In certain areas, like the muscles of the chest or muscles of the shoulder, adding fat can accentuate the shape of those muscles, the bulk of those muscles, and still be safe. When you're putting fat into deeper areas like in the thighs or calves, you need to be careful about those larger veins. But you can use fat to augment high-def lipo. It's sort of like ultra high def, or instead of 3D, 4D fat transfer. And you can get great results, but make sure your surgeon is experienced. You must stay safe.